Assalamu alaikum. This is Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. Moving on the upper right quadrant, you can see that there is a class 5 cavity on the upper right 8, which is significantly close to the nerves, and this tooth has non-fused roots. Moving to the upper right 7, this is an edentulous area, and in this edentulous area we've got 13 millimeters of ridge width with only 3.2 millimeters of ridge height. So an implant, if it needs to be placed here, will need a sinus lift procedure. This is the upper right 6. We've got maxillary tori, by the way, on the palate that you can see right here. This is the upper right 6. We have a Gostic carious lesion just next to the pulp point. So this tooth is endodontically involved. We've got the upper right 5. Looks absolutely fine to us on the x-ray here. Very attrition teeth. Teeth are not doing with the health-wise. Enamel is very weak. But on the 5 and 6, we don't see any major cavities. We see something right here on the 4 and the distal of the 5. We're presuming it is because of cervical burnout and a cavity on the distal aspect, but nothing very significant for endodontic involvement. The upper right 3 is endodontically treated. The root canal is not done very well. We've got voids, we've got a very heavy obturation, we've got a cervical filling, and at the same time we've got obturation material which is short at the apex, resulting in a periapical radiolucency as well. Moving to the upper right 2, some class 5 cavity. Central incisor also has a class 5 cavity. Both the centrals have class 5s. The lateral has on the upper left side grossly carious. No enamel structure can be seen. So this is the transaxial view of the upper left 5. The upper left lateral incisor. The upper left canine, class 5 cavity here as well. And then the premolars, and then we've got the molar. Nothing significant with the molar, and then this is the region of the 7. Here also we measure for the doctor. We've got 12 millimeters of ridge height with ridge width with 6.5 millimeters of ridge height. Now the lower left has a implant. This implant is not placed in the right angle, has significant bone loss associated with it as well. As you can see in this region, we've got periimplantitis, and the angle can also be seen that it is on the it's not placed in the right angle. We also have very thick cortical plate here. We had a very good ridge that this implant is definitely failing. Now moving to the region of the 6, here we've got good ridge. We've got approximately 11.8 millimeters of ridge width with 14 millimeters of ridge height. We've got the premolars which are endodontically treated and have crowns on them. We do see voids in the lower left 5 and 4, but no periapical radiolucencies can be observed. We've got mandibular tori present here as well, in the lower mandibular area. This is the lower right 5, endodontically treated. We don't see any major periapical radiolucency. We do see voids, and we do see that the crown structure in this tooth is quite significantly broken down. This is the lower right 6. Mesial roots have short obturation, and the distal root also has a very short obturation, which is resulting in a periapical radiolucency as well. And the region of the 7, you've got good healthy bone. It's 12 millimeters of width with a 15 millimeters of height. Thank you very much.